Mental Health Monday with Mick Coyle.
Radio City Talk.
What a great guest we had on Mental Health Monday this week. Really outstanding sort of contribution to the mental health world based on the Wirral in New Ferry. And Jessica Gallier's story was one which I think will strike a chord with a lot of people, particularly those who've been bereaved by suicide. Let's talk about it now with Jake Mills, who's here for Mental Health Extra. Jake, great to see you. How are you?
I'm very well. How are you?
Yeah, I'm great, thank you. Losing someone to suicide must be absolutely terrible in that you have lost somebody in circumstances which ultimately potentially may have been preventable. Plus you're dealing with all the grief which comes from losing anyone in any circumstances. It just struck me as particularly cruel that it's something which also creates an environment whereby not only do you lose that person in the circumstances in which you lost them, but at the same time the stigma around it means you also lose your closest friends. You lose support within community, that people cross the road to avoid speaking to you. That's like doubling down on the grief that people would be suffering. And I thought the way that Jess sort of said, I need to do something about that, and almost created a street now in New Ferry where she said it's the safest street in the UK, which I really like as a line. She said, no, that can't be. We can't have things like that.
Yeah, I mean, we're an absolute inspiration, and the story of kind of, what you're talking about there in terms of the stigma that comes to it comes with mental health. We only ever really talk about that from the perspective of somebody who's struggling with the mental health, who's unwell. That's when we really talk about the stigma, really. What we're not really talking about is the stigma that's attached to the associated people, as you've just said. In terms of, from Jess's point of view, and even though she said, she saw a dad's suicide coming a mile off, she's not the person who's being unwell. She's not the person who's died by suicide. Yet she's the person who is having the effects of those stigma, and that's why it was really it was an eye opener. I'd like to think to a lot of people to how far this actually goes. It's far beyond the person who's actually been unwell and taking their own lives, and it's the people who are left behind who feel that as well. It's the story that she told about being in the supermarket and the old lady talking to her, and then as soon as she said the word suicide, completely changes the situation. I think says more than anything that we can, really, because that's there's the living proof and the living example of how uncomfortable we feel.
But there's no I'm sure there's no malice intended. That woman, just to see someone crying in the supermarket and you go over there, you do it because there's something good in your heart that says, there's somebody crying, I need to go and take some steps. But it just goes to show the issue that we're facing here, that people who are the sort of people who would approach you in the street and say, hey, you're feeling all right, you don't look so well, are also sort of ill-equipped to deal with that situation, which sort of really paints a really bleak picture as to how bad things are actually got in regard to discussing the issue of suicide.
But that's exactly what it is. I would like to think there was absolutely no malice in it at all. But we are not, as people, as a society, we are not prepared on how to talk about these things. I think we done something recently about death, and talking about death and how trying to normalise the conversations around death as well. Might not be you, might listen to a different radio programme. There's a good chance I did. But talking about death as something that, we're all kind of, it's inevitable that we're all going to die, but we don't know how to talk about it. We don't know how to prepare about it. It's exactly the same when it comes to suicide. We are not told anything about this, and it's people like Jess who have gone through that lived experience and have then created something from that because they see that gap. How many times are we talking about this? So many people who you have on Mental Health Mondays have got lived experience or create something from that experience to then change the lives for others. And it's those people who are then doing the training or setting up services and getting the word out there. If it wasn't for them or for their experience, that wouldn't be happening. That's not good enough. We have to be prepared for something. We have to be taught and educated about something so that we can feel comfortable about it, because it is a reality. And, we're talking about suicide here, but, it's not just numbers, it's not just statistics, it's actual real life. Biggest killer of men, biggest killer of mothers with an under 1-year-old, biggest killer of young people, more than 200 school children taking their own lives. It's happening around us. We have to be talking about it, but we have to be taught how to talk about it.
What is it, do you think, that why is the reason we're not talking about it? Is this idea that if you talk about suicide, people will decide to take their own life?
I think that's part of it, but also I think that's part of, because we're not talking about it, that's what people are making up. We have to hit it head on. We have to hit it in schools. We have to be talking about it. We have to be educating each other about it. Unless you do that, unless you are talking to children about their mental health, then you will always have stigma, because it will be filled with these interpretations, these expired views, this gossip, this type of talk that is not valid anymore. But unless we're teaching people why, then it's good. We're going to fill the void with our own whatever we've gathered from anywhere else.
But I think there's sort of stigma wrapped in stigma here that, and people approach me because of the job that I do, and they say, this is the experience that we're having, what do you suggest? And because you've set up the Hub of Hope, I always suggest that, which is basically find local services plus speak to your GP. But I always say, included within the Hub of Hope, which you've got there, James's Place have a similar service, there's a text crisis line if they're feeling suicidal. So I'll often say, are they suicidal? And that's always met with a thing of, oh no, we don't really want to go down that route. And that's born out of, look, we want to help this person that's going through a difficult time, but we don't really want to consider the fact that they might be suicidal, or you don't want to. And I think it's based on the idea of, well, if we start then talking about suicide, maybe we put the idea into somebody's head, and all the evidence shows that's not the case. You're not putting an idea into someone's head. What you're doing is you're providing them with a solution to the problem, which might take them down a much better path.
Yeah, and definitely that is the case, and that's why in the assist training that Jess was talking about and training that we do, we make that point valid. But my point, I suppose, is why is it down to us to point that out to people? Why do we have to gain that access to people to tell them that? We should all know that. We should all know that. We should all have that basic level of understanding and know, okay, well, I know if I talk about suicide, if I'm worried about them being suicidal, it's not going to make them suicidal. But because we're not having that at all, those misconceptions are then becoming fact.
But but if I'm having a heart attack and I'm on my own, I think, right, I need to ring 999. I need to get an ambulance to me. If you start having a heart attack, I think I need to call 999 to get an ambulance to Jake. So, but when someone's having a mental health crisis, we don't have that thing in our mind. Now, the 999 network is a complex network of emergency services based around people dotted all over the country that can be with you at a set amount of time. So but it's framed around a very simple thing. Call this number and help will come your way. Now, do we actually need that from a mental health point of view? There you go, you know what? Somebody's having a moment there. We need an intervention and we need it now. Yeah. A first responder. And it needs something as simple as, here is the number to call. And it's not an 0800 number and it's not an 0345 number. It's a 111 or a 222 or a 333 that you can call and you get that instant response. Yeah.
However, if somebody is in a crisis, then it's 999 exactly the same way. The amount of times, and I had this conversation this morning, but again, misconceptions, this kind of stereotypes and how we are filling those gaps and voids with information that we've picked up from different places. I'll use an example without naming anybody, but somebody came to me a while ago and said that somebody they knew was suicidal and they were intending to take their own lives and she didn't know what to do. Contacted me and said, what do I do? And I said, is he about to kill himself? And he said, yeah. And I said, well, you need to contact the emergency services. And she said, but I don't want him to get sectioned. And that was enough. The idea of what that meant, what being sectioned meant, was enough to say, I don't want to call the emergency services, despite the fact his life was in danger. Again, because what does it mean to be sectioned? It's what she had, and did she think that it was going to be a straitjacket going into an asylum? Is that kind of what sectioned
But it's
is.
strange when we talk about stigma. In her mind, and I don't know what that conversation was, but in her mind, that sounds like she thought that being sectioned was in some ways worse
Exactly.
than that person actually taking their own life.
Exactly. But to be absolutely fair, how would you know what section looked like? How would we or her or anybody know any different? Because what we're doing is we're going, well, I've never been told what being sectioned is. So what I'm doing is I'm going to my mind and thinking, what is being sectioned? And it's something from a film or
It's Arkham Asylum.
exactly.
It's One Flew Over the Cuckoo's Nest.
It's being thrown into a padded room in a straitjacket or something like that. That's in her head. That's what that is. And you're thinking, okay, I want to help this person. I don't think that's going to help that person, so I'm not going to call the emergency services. Despite the reality, which is it's a place of safety. They will be taken to a place of safety. It will not look like that. You might be looked after for a day, an hour, a week, whatever that might be, but you will go to a place of safety to then be treated, to get diagnosed, to get help and support. And that's what you need. That person needs that place of safety. But for so many people, we just don't know that process whatsoever. So we just make it up.
999. It's a simple number. We all know it. And it is absolutely suitable as well. I just want to know that just needs either education or that rebranding that would come with it's not one of those situations, but it is one of these. And I'll call and I'll get the response that I'm looking for.
But just to add as well that they are looking at a 111 for mental health as well to be included.
There we go. Hubofhope.co.uk has got links to that. Jess, by the way, is nominated for the Merseyside Women of the Year Awards, as is, she was a guest on the show a little bit earlier on as well, Claire Milford Haven from James's Place as well. And actually, it was good to see that nominated within the categories. We're not showing favouritism to the people who we've had on the show, but they've been on the show, so we'll flag them up. That actually people who are doing work in this field are getting notice as well, commendations from people that this is no longer something which is going on behind closed doors. James's Place has become, one of the sort of institutions, if you like, of Liverpool. Without a doubt, the work that's going on with Gallier House is absolutely going to make a name for itself as well. These things are stepping into the mainstream a little bit more, right?
They are. Again, I think it's so easier, but particularly with the work that I do, and I'd say the work that you do as well, Mick, is that we almost become a little bit immune to the reasons behind people doing the work that they do. With the success of James's Place and Gallier's House, and it's very easy just to think that it's just a service that just exists and people are just running that service, and isn't that great? It's so easy to forget the actual reason and the heartache and the devastation behind those services. But they are the key. They are absolutely the key to helping people because they've got that lived experience, that viewpoint to actually make a difference. And I know that as part of the long-term plan from NHS, they do want to be focusing more and more on that voluntary third sector community type of approach, that grassroots type of approach, because they know that holds the key to actually getting through to organisations. And in terms of the Woman of the Year Award and Chasing Stigma, working with the Merseyside Woman of the Year Awards as well. I'm really proud to be doing that, to really highlight some of the work that's been going on.
Angela Samarta's one of your trustees. She's won it. Of course, Claire Milford Haven running James's Place, nominated Jess Gallier, who was on the show yesterday. She's nominated too. I'm going to mention Laura Hughes as well, who worked at ours, who she's nominated to for the work she's doing in knife crime as well, after losing her brother as well. But you can choose for yourself, MerseysideWomenOfTheYear.co.uk, but you can only vote once.
Yeah.
So I don't think I'll because the thing is, you read the first one and you go, well, they probably deserve to win. Click. Oh no. So make sure you read. It's like when you go into an exam, read all the questions first before you then start to answer.
Yeah, that's it. But everyone, and it sounds cliche, doesn't it? And I've hosted awards before, and it's kind of saying, it feels like it is cliche to say everyone being nominated. But it is true. Like, genuinely, it's shining a light on some of the amazing people that are doing incredible work over the city, and even people who haven't been nominated this time, previous years and future years, it's really important to shine a light on them.
Yeah, it's like if you get nominated, that's like the silver medal. So you've still got something, but there is someone better than you.
Yeah. How did those awards go the other week that you went to, by the way?
Yeah, we lost, but we lost. You know what? It's pretty funny, actually. We lost to a production company that did like an ambulance type 999 show.
Yeah. There you
Not
go.
Stacey Dooley though. She didn't. She didn't.
So she's a loser like us.
Yeah, exactly. So we'll take that. We'll take that. Jake, thank you for your time. hubbahope.co.uk. What else is going on with your charity Chasing the Stigma this week?
We've been doing our training. I can't remember who we've just trained this morning. I was desperately reaching for my phone to find out the name of the company who I've just trained staff of this morning.
You've been up early. That's fine.
Yeah, I have. We've been rolling out the Ambassador Hope training. We've got a big announcement very, very soon. We're just waiting for the ink to dry on that.
Excellent. Great to see you, as ever. Jake Mills from Chasing the Stigma, Mental Health Extra from Radio City Talk. Podcast listeners, you're about to get the Claire Milford Haven interview and the work that she's been doing at James's Place. Some great updates there in regard to the achievements of the organisation so far, and of course the nomination for Claire in that Merseyside Woman of the Year Awards. You just type that into Google. You get all the information and how to vote. You can only vote once, don't forget.
Mental Health Monday with Mick Coyle.
On Radio City Talk.